Here at Loc-a-Lump, we seek to address the current standard of care for when breast-conserving surgery is needed. The typical process starts with the placement of a biopsy clip to determine if a lesion is malignant. If so, a second invasive procedure places a localizable device which surgeons use during surgery. Then there's the lumpectomy itself, in which a surgeon extracts the area surrounding the lesion or, in more severe cases, removes the entire breast, a mastectomy. The main issue is the secondary procedure, which places the localizable device. Methods such as wire-guided localization often migrate from their original placement, cause patient discomfort, and sometimes even end in sending patients home with a portion of the wire sticking out of their breast. A barbaric concept.
Our RFID marker is placed during the biopsy procedure, so there's no need for a second localization procedure before the actual surgery. This means patients go straight from biopsy to lumpectomy, skipping the stress, pain, and scheduling issues of same-day wire placement. So it makes it easier for the surgeons to accurately find the tumor, making the whole process smoother and more efficient.
So to prototype our device, we used gelatin to simulate our breast tissue. To make it, we boiled water, stirred it with gel mix, and let it solidify. We then used this gel, along with a blink tag in it, to test visibility. A blink tag is just silicone in the shape and size of what we envision an FDA-approved tag would be. To create the blink tag, we 3D printed a mold. We then filled this mold with a medical-grade silicone. To test the read distance of our RFID tags, we went through various tags and mold designs. Here's an image of the CAD model mold and RFID tag encased in silicone that we used for our final prototype design.
We did RFID distance testing in air and in a gelatin phantom, simulating low-density breast tissue. To do this, we created standard curves for all test setups of RSSI versus distance and used linear regression models to predict distance and other collected data. We found an average relative error in the phantom of 3.58%, which at a 3 cm read range is only about 1 mm of average relative error. This is well below the current standard of less than 10 mm for localization devices considered to be highly accurate. We also did imaging testing for our scaled down silicone blank, since mammographic and ultrasound visualization are important for placement and monitoring of the device. This is our mammographic verification of the blank, displaying the good edge definition in a gelatin phantom simulating extremely dense breast tissue, and here we confirm that the same silicone blank is well visualized sonographically at a depth of 5 cm in the same phantom.
And now for the individual costs. This is our device versus the current devices in price, as you can see for the biopsy and the 3D localization marker. As you can see with our device, you'll be saving around $260 to $790 per patient. This is a $30.6 to $126 million market incentive, and this is a total potential revenue of $416 million per year per 1.6 million biopsies.